three main steps, that is the access opening, the cleaning and shaping, and the obturation of the root canal system. So today we're going to be talking about the obturation of the root canal systems. So to begin with, the root canal system has a various includes various anatomy, and it could be very challenging at times. So it always consists of irregularly shaped canals, lateral canals, which in most of the cases in lateral canals, a file is not accessible, and so a sealer and an obturation material is required, and that is why the obturation needs to be done very precisely for the filling of these lateral canals. So that brings me to my next slide, that an endodontic filling material may be considered as a very true implant, as they touch the vital parts of the tissue and the body and meet the external surface through a restoration. So the main objectives of a root canal filling is to completely obliterate the canal space and perfectly seal the apical foramen with an inert, dimensionally stable, and biocompatible material, which are the basic needs of an ideal obturation material. So that brings us to a question: why do we need to obturate the canal? So we need to obturate the canal is first to stop the coronal leakage, and to stop the microbes from entering the canals and disinfecting the canal again, to entomb the surviving microorganisms, and to prevent the percolation of fluids into the canal. And these are the primary functions of a root canal filling material. So when do we obturate the canal? So mostly obturation is done. The first basic criteria is the canal should be dry. There should be no exudates or seepage, or you have to see if there is no drainage in the canal. The tooth should be asymptomatic, no pain and or tenderness on apical, or in cases of apical periodontitis. There should be absence of any sinus tracts. There should be no foul odor or residual infection that persists. Or the temporary filling material should be in place. It should the temporary material that has been placed should not be broken or should not be leaking at any place, because that would promote the microbes to enter into the canal and reinfect them again, which will later hamper the prognosis of your treatment. So till where should you obturate the canal? So this is a very important part. So the root basically comprises of an apical constriction and the apical foramen. So the apical foramen and the apical constriction are two very important landmarks that have to be noted. So your obturation material should not cross the apical constriction. By obturation material, I mean the gutta percha. It should not cross the apical constriction, that is where the CDJ ends. You can see in the image it is 0.5 to 0.7 millimeters away from the apical foramen. So this is a very important aspect that has to be noted before obturation of the material. So the basic principles of root canal filling is: the standard root canal filling is a combination of a sealer and a core material, which is gutta percha in most of the cases. The core acts as a piston on the flowable sealer, causing it to spread and fill the voids and also the lateral canals. A three-dimensional, well-fitted root canal obturation achieves the following goals. It prevents the percolation of periapical exudates into the root canal. It prevents reinfection, and it creates a favorable biological environment for the process of tissue healing to take place. The role of a root canal filling material in endodontic success is that it should fill all the dead spaces. It should deny any nutrition to the individual microbes that are present, and it should provide a favorable atmosphere. So this is the basic requirement of a root canal filling material. Sure, you can read it. I'll just give you all a minute or two. You all can also take a picture of this slide. So the most important property of a root canal filling material is that it should be able to seal the canal apically and laterally. So the basic composition of a root canal filling material is the core material, that is the gutta percha. The gutta percha is point consists of 20% gutta percha and 80% zinc oxide. There are also dyes, salts, and other radiographic and also radio opaque materials and salts that are added for the radiographic contrast. Some manufacturers also add calcium hydroxide, chlorhexidine, and which imparts the disinfectant properties in the in the core material. So this is one of the most important property. Gutta percha basically shrinks as it cools. So when you heat the gutta percha, it basically expands, but then it shrinks. That is where the sealer comes into play, and the sealer has to be present so that it fills in the voids between the gutta percha and the tooth surface. Very initially, silver points were used as root canal filling materials. They're not used anymore. And these are resin-based filling materials, that they are synthetic resins that have been discussed and tested as endodontic core filling materials for many decades. The main advantage of thermoplastic resin is that it bonds to the sealer, which creates a monoblock concept, which does not allow any micro leakage into the root canal. So it basically creates a monoblock between your root between the root surface and the gutta percha, that is the core material. So the number of transitions between your root canal and the filling material are reduced. Sealers, these are so sealers are basically responsible for sealing of the root canal system, entombment of the remaining bacteria, and filling the irregularities in the in the prepared canal. So basically filling all the lateral canals. And if you must have noticed, the canal is never in a very straight manner. So to fill in the voids between the gutta percha and the root canal system, a sealer comes into play. So these are the basic types of sealers that are resin based, that are calcium hydroxide based sealers, that are now calcium silicate based sealers as well available. So sealer placement. Sealer placement is influenced by access opening, the canal configuration, the quality of the canal debridement, size to which the canal has been instrumented, the viscosity of the sealer, and the way the placement of the sealer is performed. So these are the instruments that are basically used for the placement of sealer, lentillar spirals used. There's a new patented instrument that is now designed for the placement of the sealer. It's basically bidirectional spiral, which produces a coronal and apical cement flow simultaneously. Because of this, the sealer basically spreads in the lateral canals as well, and the core material of gutta percha is used after this, so that the sealer is a piston like mechanism is produced, due to which the sealer flows into the root canal system. So the basic approaches for obturation is the paste only, which is very least desirable. It is not used. The single cones with paste, collateral condensation, and thermoplastic compaction. So paste only root canal filling systems were used very initially. It was into study, but then it was later not recommended due to poor reputation, and the strength of the tooth is compromised because of the absence of core material present. Single canal obturation, so basically a single gutta percha, a silver cone, or sectional silver or titanium point was selected to fit with a tug back. So the shaping is performed of the root canals, and then a single cone is fitted using the same size.